Dr. Ed Rock joins us right now, the Chief Medical Officer for the American Medical Response. Doctor, different states, different cases, I get that. But should we read anything to, in a city like New York, of course, which has been the epicenter of a lot of these cases, the mayor, maybe with the agreement of the governor, decided, all right, the rest of the year they're closed. Versus Florida, a little less severe, some problems, maybe open them up or some of them up. What do you think?
So, good morning, Neil, by the way. This particular illness and its spread is such a different illness than we've ever seen in the U.S. So what happens in Florida, what happens in New York, what happens in Arizona or California are very different. So when the decisions are made about opening business, opening schools, it's based on a whole host of factors. I think from a medical standpoint, the most important component of all of this is that social distancing, that physical distancing, and that's what stops this virus. That's what locks it out. And we have to be very cautious when we do open. We're in a different state in all of these scenarios with the new norm. And that's really important for all of us moving forward.
Dr. Fauci had talked about a glimmer of hope with some of these more positive hospitalization numbers that are showing a decline in the rate of increase, in some parts, actual outright decline. But he did caution that distancing strategies must be intensified even as we wait out the end of this month. What would be your definition of an improving scenario where you, as a widely respected doctor, would say, all right, I would entertain rolling some of these lockdown provisions, including maybe a decline in hospitalizations, a decline in the rate of cases? What would it be? What would be important to you?
So I think it's a package deal, right? The decline in new cases is clearly important. I think, as everyone has identified, the mortality rate trails the new case rate. So as we start to see new cases decline, as we start to see the classic flattening of that curve, we can start to think about reopening this social kind of lockdown scenario. But the caution here is, as we've all talked about, the new normal has to be different for a period of time. And we've had a lot of discussions about, there may be a time period where the handshake to a new stranger that we just meet, maybe we forego that for a while. We've learned a lot through this, and we will continue to learn. But that concept of preventing this virus from spreading from person to person means we don't give them, that virus, the opportunity to be close enough to be transmitted from one human to another. So all of us ought to be working on how we live in this new world to keep this viral illness and this illness burden down. It's a different world after this. Not a bad world at all. It just has to be different based on the virus.
Yeah, no, to put it mildly. I hear you, Doctor. Dr. Ed Rock, thank you very, very much.